Okay, you can go ahead and come on in. Hi, my name is Lindsay. I'm going to be doing your assessment today.
All right.
And you can go ahead and have a seat. And I was assessing her gait and posture. She walked in and saw that she was coordinated and balanced. And I'm going to go ahead and ask you what your full name is.
Vanessa Martinek.
And do you know what time it is?
It is 9:30.
And do you know where you are?
I'm at Germana.
Okay, so she is alert and oriented ×3, which is great, so we can go ahead and move on. And then I'm going to do the rest of her neurological exam, including the cranial nerves, while I move from head to toe to make it go a little quicker for me. So I see that your overall appearance is put together pretty well. You seem like you're in a pleasant mood. How are you feeling today? Do you have any pain at all?
No pain. I feel good.
Okay, I'm going to go ahead and take your vital signs.
Okay.
I'm going to do your blood pressure first. Have you had any surgeries on this side of your body or anything like that?
No, I haven't.
Alright, your blood pressure was 130 over 85, which is normal. And then I'm going to go ahead and get your temperature. Let me make sure I have And there are 3 ways to take temperature: orally, the axillary, and then rectally. We're doing oral right now. .9, that's perfect. Now I'm going to go ahead and take your heart rate. Her heart rate was 60 beats per minute, and her respiratory was 16 breaths per minute. And now I'm going to go ahead and take your oxygen saturation. It shouldn't take too long. And it's 98%, which is great. So now that I've taken your vital signs, I'm going to have you come over and I'm going to get your height and weight.
Okay.
Alright. So, got your height, and then, sorry if you'll jump back in. Alright, you can go ahead and sit back down. And then I'm going to go ahead and move from head to toe, and I'm going to start with just assessing this portion of your body. So I'm just going to go ahead and start with your head, and I'm just going to be inspecting her symmetry to make sure that it's equal. I'm looking for any lesions, bumps, bruises, things like that. And then I'm going to move on and start looking at her scalp, and I see that her scalp is intact. She has no lesions, no dryness, no patches of baldness or anything, so that's great. And then after that, I'm going to actually have you shrug your shoulders and then move your head, so we're doing active range of motion while assessing her cranial nerves at the same time. And now I'm gonna go ahead and move to your eyes. So I'm gonna get my ophthalmoscope first. And I'm gonna be looking in her eye, and I'm gonna be looking at her conjunctiva to make sure it's pink. I'm making sure her sclera is clear. I'm making sure there's no jaundice. I'm gonna use the ophthalmoscope to look at the veins and arteries as well as her optic disc. And then I'll be able to assess her pupil reaction to the light as well. All right, that looks great. And now I'm just gonna have you get up and we're gonna do the Snellen chart, and this is also assessing her cranial nerve. So if you could go ahead and read line 8 for me.
DEFPOTEC.
Okay, can you cover your other eye and read the same line?
DEFPOTEC.
Okay, great. And you wear contacts, correct?
Yes, I do.
Okay. So she has 20/20 vision, so that's great. I'm gonna go ahead and test your peripheral vision, so tell me when you can see my fingers.
Yeah.
Okay, and then go ahead and look at my finger and follow it. And this is testing her lateral eye movement and convergence. All right, great. So her optic cranial nerves, her oculomotor, her trochlear, those, and her abducens are all great. So now I'm gonna move on to your ears, your eyes, and your ears, throat, and nose. I'm gonna get my otoscope. I'm gonna look at your ears first. And then I'm just gonna pull up and back and let me know if that hurts. Do you feel any pain?
Nope.
And I'm just looking in her inner canal as well as her outer canal and pinna. It's intact. Inside, I don't see any swelling or inflammation, no redness or wax buildup. So now I'm just gonna look up your nose. Same thing, I see no swelling, no inflammation. Do you feel congested at all?
No, I don't.
All right, can you open your mouth for me? Okay, her oral membrane's intact, her gums are pink, she has all of her teeth. Can you move your tongue up, down, and side to side? And can you move your jaw for me? Perfect. I'm going ahead and assessing all of those cranial nerves just to get them out of the way because they do take a little bit of time. And now I'm gonna go ahead and do the whisper test. So I'm gonna cover your ear and whisper a word and tell me what I'm saying.
68.
Okay, perfect. And I would do that on her other ear as well, but for this purpose, for the purposes of this video, I'm gonna move on. She has no indication of nystagmus. Her visual fields are intact, and there are no obstructions in her nose. I'm gonna go ahead and feel your sinuses while I'm here. So tell me if there's any pain.
Nope.
Okay, no swelling. Perfect. All right, now I'm gonna move on. I'm gonna test your gag reflex and your swallowing capabilities. So I'm gonna come behind you and go ahead and swallow for me. Okay, so her swallowing is intact, which I have just observed. And then I would take the tongue blade and test her gag reflex, which I'm not gonna do right now. And then I'm also gonna test her sense of smell. All right, tell me what you smell.
Alcohol.
Okay, it is like alcohol pads, she is right. Okay, and then how often do you brush your teeth?
Twice a day.
Okay, great. So now I'm going to inspect her neck, and I'm also going to feel her lymph nodes to make sure that they're not swollen or that she feels any pain. And I'm not really going in any particular order right now. But there are 10 different lymph nodes. And just let me know if any of this hurts. All right, perfect. And so while I'm going through the assessment, moving from head to toe, I'm assessing her skin the entire time. I'm checking for vascularity. I'm checking the tinting of her skin, which she has none. She has no skin turgor. Her hands are warm. The color is normal for her. There is no edema, which is great. She has no clubbing of the nails. It's a good appearance. I don't see any lesions or cuts or bruises. And how often do you shower?
Once a day.
Okay, great. So I'm going to move on to the respiratory system, and I'm first going to be inspecting her breathing pattern, seeing that she's not shallow of breath or it's not any labored breathing is present. And I see that she has symmetrical chest expansion as well. So now I'm actually going to palpate first. I'm going to check her tactile fremitus. So if you can say 99.
99. 99.
All right. And then I would just keep moving in a ladder formation doing this.
99.
down her back as well.
99.
And then I'm also going to feel for any air pockets in her chest in between the intercostal spaces, which I feel none. Sorry, my hands are cold. Okay, and now I'm going to percuss throughout, and you're listening for resonance. You're putting it between the intercostal spaces. You're listening for resonance. Make sure not to get it over the bone, or you will hear dullness. And then you would just continue in the ladder formation in the front and then in the back as well, making sure in the back to avoid the scapula because you will hear a dull sound over that. All right, great. So tactile primitus was felt throughout. And now I'll move on to auscultation, and I'm just listening to her lungs and listening for normal breathing sounds. I'm making sure I don't hear any kind of adventitious sounds such as wheezing or any fluid in her lungs. So go ahead and take a deep breath for me. And another deep breath. And you would continue moving on in the ladder formation in the front and the back. Take a deep breath. And normally you listen for one whole inspiration and one expiration. That is one breath. And so she had normal breathing sounds, which is great. And do you have a cough or anything?
No, I don't.
And do you have any sputum?
No.
Are you a smoker?
No.
Okay, and then her oxygen saturation was 98%, so that's great. Now I can move on to the cardiac system, and I'm going to be listening to her heart sounds, and I'm listening for the S1 and S2, as well as listening for extra sounds such as the heart murmur, S3, galloping. And I'm going to be listening for the strength of her heartbeat and then the rhythm as well. So I'll start by listening to the aortic, the pulmonic, the Erb's point, the tricuspid, and then the mitral valve. Okay, and S1 and S2 was heard throughout. And then I would check her to make sure there's no edema, and then I would check her capillary refill. Since she has fingernail polish, you can do the underside of her nail, and it's under 3 seconds, so that's good. And then her, if you can turn to the side for me, she has no indication of DVT right here, and then her color and temperature is normal. So now I'm going to move on to her pulse points. I'm going to start with her temporal up here, and then I'm going to move to her carotid. Right here is her brachial, her ulnar, and then her radial. The femoral is up here in the groin area. Popliteal is behind the knee, which can sometimes be hard to feel. The posterior tibialis here on the ankle, and then the dorsalis pedis on the foot. And then the apical pulse is the best pulse to listen to when you're trying to get a good reading because it's closest to the heart, but you listen to that instead of palpating for it. So now I'm going to move on to the GI, and I've already observed your swallowing, that it's intact, and you're chewing gum, so I can see that you're chewing that, and that those cranial nerves are intact. Okay. And now I'm going to go ahead and inspect her abdomen. So if you can just lie back for me. Have you had any change in your diet or appetite?
No.
Any recent weight loss or weight gain?
Nope.
Okay, so I'm just going to be inspecting her abdomen, looking for any lesions or superficial masses that I may see. And then I'm going to go ahead and percuss, and I'm listening for tympanic sounds. And you just go in all 4 quadrants. But before you percuss, you should auscultate first. And normally you listen to each quadrant for 30 to 60 seconds, but I'm gonna move a little quicker just for this video. And you're just listening for active vowel sounds in each quadrant. Okay, and then you would move on with your percussion, listening for tympanic sounds, and then you can finish with light palpation. And so let me know if any of this hurts you. You're assessing for pain, rebound tenderness, you're feeling for any masses, you're feeling over the liver for an enlarged liver. And then you're also checking, you can check for distension of the bladder here as well. Okay, you can go ahead and sit up. And then I'm just gonna ask you a few questions. Do you experience any constipation or diarrhea?
No.
Okay, do you ever strain going to the bathroom?
No.
How often do you have a bowel movement?
every day to every other day.
Okay, and when was your last bowel movement?
Last night.
Okay. And then I would ask her the same questions about her urinary output. Do you have any problems with your urinary output?
No, I don't.